daily count of COVID-19 cases in LA County today topped 2,000. The highest number this week and the highest we've seen since early August. And as NBC4's Patrick Healy reports, the upticks concerned public health officials and may keep the LA County there in the most restrictive tier.
Even as the presidential vote count is commanding our attention, surging COVID cases have hit an alarming milestone, yesterday surpassing 100,000 a day.
There's definitely surges happening across the country. We're not seeing that yet here.
And yet, as Public Health MD Paul Simon was quick to point out during this afternoon's online briefing, the graph of LA County's new cases has for more than a month shown a steady increase, with 2,065 new cases counted the past day.
With the colder weather, more people, being inside, a mix of circumstances that could lead to an accelerating increase.
What is driving it? The red line on this chart shows a recent jump in spread traced to general workplaces. The white line specifically food services. Sports titles the past month were marked with gatherings of many undistanced and unmasked, though by then the renewed spread was already underway.
What we think may be happening is that there are more gatherings.
So a renewed plea with Thanksgiving and year-end holidays fast approaching.
Try to do it virtually. That's a very hard message, but to the degree we can at least minimize those large family gatherings, I think it would be helpful in reducing the spread of the virus.
Indoor dining and most classroom schooling remains closed in LA County. And with the uptick, Dr. Simon believes even with credit for so much testing, moving to a less restrictive tier is still a ways off.
You factor that in, and it's at least 4 weeks and maybe longer till we would even have a chance of seeing a decline in our case rate.
In other words, next month, December at earliest. Now, of course, the more testing you do, the more COVID cases you're going to find. And that's why the state does give a credit for areas like LA County that do a lot of testing. With that credit, our current COVID rate, the state calculates to be 7.5. But 7.0 is what we have to get down to in order to move into the next tier. And we have to maintain that lower rate for 2 weeks before we can make that move. Reporting live, Patrick Healy, NBC4 News.